Welcome. In this video, we are going to discuss respiratory module test. So there are a total of 50 questions in this module test. So let's get started. Moving toward question number 1, we are having during development of body cavities, pleuropericardial folds contain which of the following structures? Number A, common cardinal veins, common cardinal vein and phrenic nerve, posterior cardinal vein and phrenic nerve, anterior and posterior cardinal veins, phrenic nerve and cardiac plexus. So during development at the week 4, the pleuropericardial folds contain common cardinal vein and there is a phrenic nerve in it. Moving to our question number 2, trachea is lined with pseudostratified ciliated columnar epithelium. The epithelium is derived from neuroectoderm, endoderm, ectoderm, visceral mesoderm, mesoderm, and fourth and sixth pharyngeal arches. So epithelium along with the glands and seromucinous gland lined in the trachea and the bronchi are derived from endoderm, because the respiratory system is derived from mesoderm, which is a visceral layer, and endoderm. The mesoderm gives rise to cartilages, muscles, as well as smooth muscles, and the endoderm gives rise to these epithelium. So question number 3 says non-ciliated cuboidal cells in the bronchial epithelium involve detoxification of noxious substances and act as a reserve cells are cheese cells, goblet cells, basal cells, chlora cells, and type 1 pneumocytes. So since these are non-ciliated with the cuboidal in shape and they lines the bronchial epithelium, they are called chlora cells. Now, question number 4 says a surgeon entered into the right pleural cavity and excised two suspicious lymph nodes in the hilum of the right lung for biopsy. These lymph nodes belong to which of the following group of lymph nodes? Paratracheal, parasternal, inferior tracheobronchial, superior tracheobronchial, or bronchopulmonary. The whole of the lung along with the visceral pleura is drained by the bronchopulmonary nodes. Question number 5 says 50-year-old male is diagnosed with a pleural effusion. A chest tube is inserted to drain the effusion fluid through an intercostal space. Which are the following location in the chest wall is used for chest tube insertion? It is inserted superior to the upper border of the rib, inferior to the lower border of the rib, at the middle of the intercostal space, between the internal and external intercostal muscles, between the intercostal muscles and the posterior intercostal membrane. Whenever there is an insertion of any tube or a needle into the body cavity, which in the thoracic cage, it is always inserted superior to the upper border of the rib. If we insert it inferior to the lower border of the rib, it may lead to damage to the neurovasculature line in the costal groove. So that's why. So question number 6 says the hospital acquired pneumonia is most commonly caused by gram-negative organisms, gram-positive organisms, fungi, parasites, or viruses. So there are two causative agents for the hospital-acquired pneumonia. These includes the Streptococcus aureus or Staphylococcus aureus and the Escherichia coli or E. coli. So E. coli is basically the gram-negative organism. So option A is correct. Moving toward question 7, destruction of elastic cartilage is most commonly termed as chronic bronchitis, emphysema, bronchiectasis, pneumonia, or asthma. When there is a destruction of the elastic tissue in the alveoli or we say lungs, it is termed as emphysema, while chronic bronchitis is a condition which is an inflammation of the bronchus. Question number 8 says which of the following cells are most commonly seen in during gray hepatization phase pneumonia? Neutrophils, macrophages, erythrocytes, platelets, or lymphocytes. So macrophages are the most commonly seen cells in the gray hepatization phase of the pneumonia. The phases of pneumonia includes first one there is a congestion, then there is a red hepatization, then gray hepatization, then resolution. So fourth phase of pneumonia is resolution. So in red hepatization, there are the erythrocytes, while in gray hepatization, the erythrocytes are destroyed, therefore giving a gray-like appearance. and macrophages are the most abundant cells. Moving towards question number 9, which says Nielsen staining is most commonly used for the staining of gram-negative organism, gram-positive organism, acid-fast bacilli, fungi, and parasites. Certain staining is used for the identification of the acid-fast bacilli because they are not stained by any other dye, or we say any other gram dye. That's why. These acid-fast bacilli include the Mycobacterium tuberculosis. So moving to our question number 10, which of the following microorganism is most commonly present in unpasteurized milk products? Mycobacterium bovis, Mycobacterium avium, Mycobacterium hominis, Mycobacterium tuberculosis, Mycobacterium kansasi. It includes Mycobacterium bovis. After a road accident, 30-year-old male patient came to casualty department complaining of severe localized pain in thoracic region. Radiological examination revealed rib fracture, which a part of the rib is most commonly affected: neck, tubercle, angle, shaft, or head. So the side at which the ribs are most commonly damaged or there is a fracture, these are the angle of the rib. Question number 12 says which one of the following layers provide a natural cleavage plane for the surgical operation of the costal pleura from the thoracic wall? Deep fascia, endothoracic fascia, parietal pleura, visceral pleura, and transversus thoracic muscle fascia. Endothoracic fascia basically is in between the parietal pleura and the internal intercostal muscle, or we say innermost intercostal muscle. So this in endothoracic fascia provides surgical cleavage plan. Question number 13 says a 50-year-old patient brought to the emergency department with a complaining of chest pain and headache. His CT scan shows tumor located just superior to the root of right lung. Which of the following is most likely blocked by this tumor? Right subclavian vein, right brachiocephalic vein, arch of azygous vein, accessory hemiazygous vein, or hemiazygous vein? Since the tumor is located on the superior border of the root of the right lung, we can say the arch of azygous vein can be compressed by this tumor. So I have a picture here. You can see here that the arch of azygous vein crosses over the root of the right lung. When there is a tumor located superior to it, it can compress the azygous vein. Now moving toward question number 14, say the middle-aged chain smoker man developed lung cancer that is spread into his left second intercostal space posterior to mid-axillary line. Cancer cells carried from venous drainage first entered into which of the following veins? Hemiazygous vein, azygous vein, superior vena cava, left anterior intercostal vein, or left brachiocephalic vein. The tumor is located in the second intercostal space posteriorly, so it is drained by the posterior intercostal veins, and the veins of the posterior intercostal vein located in the second intercostal space is directly drained into the left brachiocephalic vein, while the venous drainage from the first and second intercostal space of the right, or we say right intercostal space, is drained directly into azygous vein. So moving to question number 15 says middle-aged woman developed lung carcinoma that involved hilum of her right lung. Which of the following structures are present in the right lung hilum? Two bronchial arteries, single bronchial artery, principal bronchus, pulmonary vein, or lymphatics? In this question, it is asking about the specificity of the right lung that differentiates it from the left lung. So all of the points just are the common in both lungs, but the presence of single bronchial artery in the right lung hilum and two bronchial artery in the left lung hilum differentiates both. Now question number 16 says a patient present with a hoarseness of voice after he underwent surgery of removal of tumor posterior aspect of trachea. Which nerve is involved? Right recurrent laryngeal nerve, left recurrent laryngeal nerve, or right vagus nerve, left vagus nerve, or pulmonary plexus? In this type of surgery or in this type of question, most commonly damage to the nerve which causes the hoarseness of voice is called is the left recurrent laryngeal nerve. Although recurrent laryngeal nerve can also cause hoarseness of voice, but the most commonly injured nerve is left. Question number 17 says pulmonologist or pulmonologist removed tumor mass from the right lung involving bronchopulmonary segment of middle lobe of the right lung. Which of the following is not present within the bronchopulmonary segment? Segmental vein, bronchus, segmental artery, lymph vessels, autonomic nerves, segmental vein. When we examine the segment of any of the part of the lung, it does not have a segmental vein, while it has segmental bronchus and segmental artery. So segmental vein is the correct answer. Question number 18 says a man was hit by a car and received multiple injuries to the chest, which resulted in fracture of upper six ribs. First sternocondral joint is type of primary, secondary cartilaginous, synovial, fibrocartilaginous joint, or fibrous. So first sternocondral joint is type of primary cartilaginous joint. Question number 19 says a 3-year-old boy is examined by the pediatrician with a history of inhaled foreign body, suffering from difficulty in breathing, where this foreign body is most likely to be found on bronchoscopy: trachea, right bronchus, left bronchus, carina, or larynx. Whenever there is a case of swelling of any foreign object, it will most commonly found in the right bronchus. I have a picture. You can see here that the right bronchus is a short, it has a broader, and it has a more vertical trajectory as compared to the left bronchus. That's why the most commonly foreign bodies are found in the right main bronchus. So question number 20 says a 56-year-old male patient present with a sliding hiatal hernia in the diaphragm. Which other structure can be compressed by this hernia? Right vagal branches, azygous vein, thoracic duct, splanchnic nerve, inferior vena cava. Hiatal hernia is most commonly seen in the esophageal opening, which is present at the T10 of the diaphragm opening. So along with the esophagus, the right vagus branch also passes through that esophageal hiatus in the diaphragm. That's why when there is a hiatal hernia, it can damage or it can compress right vagal branch. In OPD, the patient present with a stage 3 carcinoma of lung with a metastasis to brain. Visceral pleura is drained by superficial plexus, bronchopulmonary nodes, deep plexus, tracheobronchial nodes, bronchomediastinal nodes. So all of the lung parenchyma is along with the visceral pleura is drained by bronchopulmonary nodes, which will eventually drain into the tracheobronchial nodes and then to the bronchomediastinal nodes. Question number 22 says a patient is brought for the cardiac catheterization due to the sudden occlusion of descending thoracic aorta that causes decrease in the blood supply of which of the following arteries? Right bronchial artery, left bronchial artery, pulmonary artery, posterior intercostal artery, or 10th anterior intercostal artery. So the descending thoracic aorta basically gives off branches to supply the posterior intercostal artery. These are called posterior intercostal artery, which supplies the intercostal space posteriorly. That's why if there is a occlusion in the descending thoracic aorta, it can cause the reduced or no blood supply towards the posterior intercostal arteries. Question number 23 says radiologist while reading X-ray of a patient saw a mass located near lingula of a lung. Lingula is the extension of lower portion of upper lobe of the left lung, upper portion of the upper lobe of the left lung, lower portion of the upper lobe of the right lung, lower portion of the lower lobe of the right lung, middle lobe of the right lung. So lingula is basically present in the left lung. So we will left with the only option A and option B. But the lingula is present in the lower portion of the upper lobe. I have a picture you can see here that this is the superior lobe of the left lung, while this is the inferior lobe. The lingula is the part of the superior lobe and it is present in the inferior part of the left lung. A post-operative surgical patient has a nasogastric tube in for 3 days. The nurse caring for the patient stated that there was much drainage from the tube. That is why she felt so sick. What could be the reason? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, or respiratory alkalosis. Whenever there is a nasogastric, or we say there is a drainage from the nasogastric tube, which is inserted into most commonly in the stomach. When there is a removal of fluid from the stomach, which is the highly acidic in pH and contain hydrochloric acid. When there is a loss of acid from the body, it would cause the alkalosis in the body, or it would cause the increase in the concentration of bicarbonate ion, which increases the pH. So that's why it's going to be the metabolic alkalosis. Question number 25 says in TCA cycle, the ATP synthesized at the substrate level phosphorylation is catalyzed by the enzyme succinate thiokinase, citrate synthase, isocitrate dehydrogenase, succitate dehydrogenase, oxaloacetate carboxylase. So in TCA cycle, succinate thiokinase is an enzyme which causes the formation of ATP. This is an enzyme that catalyzes the reaction of succinyl coenzyme A to form the succinate, and in turn gives the GTP molecule, which in turn gives the ATP molecule. Now 26 says endogenously synthesized triglycerol is transported from liver to extrahepatic tissue by LDL, IDL, HDL, LDL, VLDL. So triglycerides within the body from the liver to extrahepatic tissues, or vice versa, are transported through the VLDL, because the chylomicron and the VLDL are the major carriers of the fatty acids or triglycerols. 27 says at pH 7.4 of the plasma, the ratio of bicarbonate ion to hydrogen carbonate ion would be A 7:4, 10:1, 20:1, 30:1, 1:20. So this ratio is 20:1. In electron transport chain, ATP is reduced when protons are pumped into the intermembrane space, when protons are pumped back into the matrix, when electrons are being transferred, when coenzyme Q is reduced, when cytochromes are reduced. When we look at the electron transport chain, or ETC, the ATP is synthesized through the formation of a electrochemical gradient, which is formed by the pumping of hydrogen ion into intermembrane space. When those hydrogen ions are transferred back into the matrix of the mitochondria, it in turn causes formation of a ATP. So when protons are pumped back into the matrix, that's why ATP is produced. Synthesis of ceramide involves the combination of the following: choline and sphingosine, fatty acid and sphingosine, palmitoyl CoA and serine, serine and NADP, UTP, glucose and sphingosine. Ceramide is basically the combination of fatty acid with the sphingosine. Coenzyme A is synthesized from which of the following vitamins? Vitamin A, vitamin C, niacin, folic acid, pantothenic acid. Pantothenic acid is involved in the formation of coenzyme K. Which one of the following condition has a normal anion gap metabolic acidosis? Starvation, uremia, lactic acidosis, diarrhea, or ketoacidosis? So diarrhea is an example of a normal anion gap metabolic acidosis, because in diarrhea there is a loss of chloride, so there is a loss of bicarbonate ion through feces or any other excretion method. So loss of bicarbonate ion causes the increase in hydrogen ion concentration, but the chloride ion is replaced by the bicarbonate ion in the blood. That's why the anion gap is normal. Rotinine inhibits transfer of electron by competing with coenzyme Q through complex 1 NADH-Q reductase, through complex 3 NADH-Q reductase by blocking the electron transfer from cytochrome P to C1 by inhibiting their terminal transfer to molecular Q2. So basically there are two types of the inhibitors of the electron transport chain. One is the called uncouplers. Uncouplers basically forms the another hydrogen ion concentration gradient or channel for the hydrogen ion concentration or hydrogen ion to pass from the intermembrane space into the matrix without producing ATP. That's why inhibiting the electron transport chain. But other forms of the inhibitors include rotenone and other chemicals that causes the blockage of the complex 1, so inhibiting the electron transport chain. Lecithin sphingomyelin ratio of amniotic fluid in pregnant females helps in evaluation of fetal heart rate, fetal head size, fetal lung maturity, expected date of delivery, fetal length. So lecithin sphingomyelin ratio in the amniotic fluid is measure of the fetal lung maturity. Which of the following substance will cause bronchodilation? Beta blockers increase alveolar CO2, histamine, SRSA, parasympathetic stimulation. Bronchodilation is caused when there is an increase in the alveolar carbon dioxide. Beta blockers, when we blocks the beta 2 receptor, it will cause the bronchoconstriction, while histamine is also powerful bronchoconstriction, while parasympathetic stimulation can cause bronchoconstriction. Holden effect means increase O2 displaces CO2 from hemoglobin, decrease CO2 displaces oxygen from hemoglobin, increase CO2 displaces oxygen from hemoglobin. In tissues, it causes less CO2 binding. In lungs, it causes less CO2 release. So Holden effect and Bohr effect are the two types of effects that we see in the transport of gases within the human body. So Harden effect is most commonly seen in the lungs when there is a oxygenation of hemoglobin displaces CO2 from the hemoglobin and causes excretion of the carbon dioxide, while the Bohr effect causes the increase in CO2 displaces oxygen from hemoglobin, and this effect is seen in at the tissue level. Question number 36 says factors which increase pulmonary compliance include kyphosis, surfactant scoliosis, surface tension, or tuberculosis. So surfactant is basically the compound which causes the increase in compliance of the lungs. Features of CO poisoning include it can cause dark blue coloration of tissues, it can cause severe difficulty in breathing, occurs when coal burns in a closed place, or is a person always shout for help. So in this we see the option D is correct. Features of chronic mountain sickness include right ventricular hypertrophy, left ventricular hypertrophy, systemic hypertension, severe anemia, decreased blood viscosity. So most commonly symptoms of the chronic mountain sickness is the right ventricular hypertrophy. This is due to the hypertension in the pulmonary circuit. When there is a hypertension in the pulmonary circuit, the right ventricle of the heart needs to work hard. That's why it increases in size. That's why it causes hypertrophy. While there is no systemic hypertension, while the systemic hypertension can cause left ventricular hypertrophy. 39 says feature of Cation disease include occurs in fishermen called disease of oceans. Person goes rapidly down, bubbles of N2 are formed, treated by decompression. Cation disease is also called decompression sickness and it is caused by bubbles of N2 that are formed when the person ascends rapidly from the deep water surface to surface of the water. Shin strokes breathing basically occurs due to failure of heart to pump properly, failure of lungs to ventilate properly, decreased sensitivity of the respiratory center, increased heart brain circulation time, or decreased lung brain circulation time. Shin stroke breathing basically is due to the increase in heart brain circulation. Can be caused by the heart failure. Heart failure causes the less blood to supply to the brain that can cause stroke. The glottis is closed while the lungs are full with air. Suddenly, the abdominal and intercostal muscle contract, creating a pressure that blows the air out of the respiratory passage. Is described as a sneeze, a hiccup, a cough, a laryngeal spasm, or a gag. This is a type of cough. In children born at high altitude and brought up there, which of the following features will be there? barrel-shaped chest, chronic anemia, small heart, systemic hypertension, or increased work capacity. So children born in high altitude tends to have barrel-shaped chest. Barrel-shaped chest basically increases the compliance, or we say increases the anteroposterior diameter in the thoracic cavity that causes the lungs to expand more. 43 says a person working in a cotton factory is suffering from dyspnea and cough. He is diagnosed to be suffering from restrictive lung disease, which you expect in this spirometry. Decreased vital capacity, decreased total lung capacity, decreased forced expiratory reserved volume V1, increased residual volume or increased forced residual capacity. In restrictive lung disease, the size of the lungs is or the alveoli is going to be collapsed, and there is a less amount of air present in the lungs. That's why the total lung capacity is most commonly decreased in the restrictive lung disease. I would display a chart here. You can see that the total lung capacity in restrictive lung disease is decreased, while in obstructive lung disease, patient are having difficulty in expiration. That's why the air accumulates in the lungs, increasing the total lung capacity. While in the restrictive lung disease, the total lung capacity is decreased. While the most differentiating feature is the FeV1 to FVC ratio, which is increase in restrictive lung disease and decrease in the obstructive lung disease. So in this question, we are left with the only one choice, that is decreased TLC, that is only specific for the restrictive lung disease. While the residual volume as well as forced vital capacity is basically same for the restrictive and obstructive. That's why we need to choose the best answer in this question. Hyaline membrane disease of newborn is caused by deficiency of surfactant, pulmonary infection, alveolar septal injury, or pulmonary infarction, pulmonary edema. Hyaline membrane disease is also called the respiratory distress syndrome, and this is caused by the deficiency of the surfactant. So 45 says prior test screening for the tuberculosis infection is medical history, physical examination, typical skin test, chest radiography, bacteriological exam. Tuberculin skin test or Montauk's test is also used for the screening for the tuberculosis. This test is done by the injection of any peptide sequence of the Mycobacterium tuberculosis into the dermis of the skin of the patients who are exposed or who are at a risk. So that if there is a swelling and there is a hypersensitivity to the dermis of the skin after 2 to 3 days, the test is positive. Question number 46 is what is the most important carcinogenic component of cigarette smoke? Carbon monoxide, tar, nicotine, carbon dioxide, sulfur dioxide. So in cigarette smoke, tar is the most carcinogenic compound. Which of the rising levels of atmospheric gas is the principal cause of global warming? Carbon dioxide, nitrous oxide, sulfur dioxide, methane, or industrial gases? So carbon dioxide is basically also called the greenhouse gas, and it is always or most commonly involved in the greenhouse effect, which can lead to the global warming. Question number 48 says a 16-year-old asthmatic patient develops drug-induced skeletal muscle tremors. Most likely the cause of this drug adverse effects includes albuterol, fluticasone, montelukast, hypertropium, or theophylline. Muscle tremors and the seizures are basically the side effects of beta blockers, which include beta agonists, which include albuterol. Red-green color blindness is most commonly adverse effect of pyrazinamide, isoniazid, ethambutol, rifampin, or streptomycin. So red-green color blindness is caused by the ethambutol, which is used in the treatment of tuberculosis. Neurotoxic effects like peripheral neurotoxicity, common adverse effect of ethambutol, isoniazid, pyrazinamide, rifampin, or streptomycin. Peripheral neuropathy is seen in the isoniazid. So that was the last question. We have completed our respiratory module test. If you like this video, like and share it with your friends also. So We have also been working on our Facebook page as well as we have a website. You can visit our official web page on www.mtsonlinelecture.weebly.com. On this website or web page, you can get ton of lectures from LECTURIO, Osmosis, KENHUB, which are free to access, and they're no longer required with no fees. There are video lectures, concise notes as well as quizzes. Thank you for watching. We'll see you next video.